Okay, thank you for joining this training. Okay, we will start for ergonomic trainings. You can hear my voice? Okay, I proceed. Okay, here for the introduction. What is ergonomic? Okay, ergonomic is the scientific discipline concerned with understanding of interaction among human and other elements of a system, and the profession that applies theory, principle, method, and data to design in order to optimize human well-being and overall system performance. Okay, ini the definition by International Ergonomic Association lah. But the easy to understand ergonomic is fitting the job to the worker. Okay, it's including your workstation, tools, and also equipment lah. Okay, maksudnya you kena job tu kena fit to the worker. Okay, okay, here some of the guideline for ergonomics. Okay, here list of guideline under Occupational Safety and Health 1994 is mostly from the Department of Occupational Safety and Health, DOSH. Okay, here some guideline on occupational safety and health for standing at work, for sitting at work, occupational vibration. Okay, and guideline on ergonomic risk assessment at workplace 2017. Okay, so here statistic or trending for occupational musculoskeletal disorder lah related to ergonomic. Okay, so here some so has reported increasing trend of employees compensation from work-related musculoskeletal disease. Okay, so dia adalah disease berlaku disebabkan ergonomic lah. Okay. So ini statistik from Jabatan Keselamatan dan Kesihatan Pekerjaan. Okay, so in 2018, dah 5 years, this one jumlah kemalangan pekerjaan ada 35,460 lah. Okay, yang berkaitan dengan pekerjaan. Okay, so from the statistic, there is 4%, which is 408 cases related to gangguan musculoskeletal pekerjaan. Okay, nampak kan gambar-gambar tu related dengan ergonomic. Okay, so why ergonomic is important? Okay, is to prevent risk from injuries or illness lah, and can recurring persistent pain may develop in the future. Most treatment are costly. Okay, costly, then some of them are irreversible, incur cost to employers lah, man hours, insurance semua, and reduce productivity of the company lah. Okay, so this is disease named work-related musculoskeletal disorder lah. Okay, is disorder, injury or disorder of the muscle, nerve, tendon, joints, cartilage, and spinal disc lah. Okay, which is condition the work from the work environment and performance of work contributes significantly to the condition. And the condition is made worse or persist longer due to the work condition lah. Okay, mungkin terlalu cara kerja, angkat barang tu terlalu berat, pun terlalu lama kita tengok PC ke. Okay, you can get the work related musculoskeletal disorder. Okay. So here common musculoskeletal disorder. Okay, this common of disorder which is muscular or tendon strain, tendinitis, ligament sprain, tension neck syndrome, thoracic outlet compression, rotator cuff tendinitis. Okay, banyak lah. Banyak common of NSD lah. Okay. So it is, as you know, prevention is better than cure lah. So we need to prevent from any injury. So that's why we have to know what is ergonomic. Okay. Okay, so this one risk factor associated with musculoskeletal disorder. Okay, first risk factor is awkward posture. Okay, contoh dia working overhead, kneeling, back bending forward, squatting, neck bending, reaching. Okay, ini adalah contoh-contoh awkward posture. Okay, which is the position of the body while performing work activities that deviated significantly from the natural position lah. You macam benda tu is abnormal lah, abnormal. Okay, so it's awkward posture. Also, forceful and sustained exertion. Okay, it is a use of high level force while transporting or supporting load. Okay, contoh lifting, lowering, pushing, pulling, carrying, moving and load using hand lah. Okay, ini sebagaimana yang kita tahu sebagai contoh kita punya attendant, okay, linen, okay, the pushing trolley, store. So it's related to this kind of full sustained exertion lah. This kind of risk. Okay. And third one is repetitive motion. Okay, repetitive motion is repeated movement of the same group of joint and muscle too frequent, too quickly and over a long duration lah. Okay. Sebagai contoh, kita banyak click on the mouse repeatedly, okay, setiap 8 jam kita hanya click mouse, okay, keyboard at all time. Okay, that's why is nama dia repetitive motion lah. You do the same thing repeated. Okay, is repetitive motion. Okay, next is static and sustained posture. Body held on to a particular position of a longer period. Example, prolonged sitting and standing. Okay, sama juga macam kita duduk dekat kerusi selama 8 jam dan buat kerja office hour, okay, 8 jam ataupun standing selama 8 jam memang agak lama, itu adalah static and awkward posture, sustained posture. That's why you need doing exercise at least 5 minutes within 1 hour ke, okay, need to do exercise. Okay, walaupun kita ada rehat tapi sebelum rehat from 1 o'clock tu pun kena exercise lagi. Okay, and also vibration. Okay, vibration ni macam biasalah sehari kerja construction ataupun dibawa forklift ada vibration. Okay, dia boleh menyebabkan MSD lah, musculoskeletal disorder. Okay, another risk factor is environmental factor, which is extreme temperature. For now, okay, memang extreme, temperature sangat panas. Okay, it can relate to MSD. Okay, lighting also dan juga noise lah. Okay, so this one, this common work-related musculoskeletal disorder. Okay, there is symptoms that we can feel lah. Okay, discomfort, pain, numbness, loss of motion, spasticity, stiff joint, burning, swelling, tingling, inflammation, throbbing, and also paralysis lah. Okay, and this is common skeletal disorder, which is siapa yang pernah dengar carpal tunnel syndrome. Okay, this carpal tunnel ni related to kita punya tangan, dia rasa numbness lah, dia rasa macam sengal-sengal lah, macam dia ada nerve dia ada problem lah kat situ. Okay, dan juga tennis elbow, nama dia bursitis, ischemia. Okay, banyak lah nama-nama dia. Okay, some yang kita pernah dengar ni herniated disc, banyak. Okay, semua banyak sebenarnya yang related to MSD. Okay, so this is risk control based on ergonomic approach. Macam mana you nak control from daripada risk tu. Okay, this is how to control the risk. We can follow hierarchy of control. Okay, the most effective for hierarchy of control ni by doing elimination. Maksudnya kita kena remove the hazard. Okay, macam mana nak remove hazard? Kita memang tengah bekerja, tak boleh nak remove kerjaan tu, tak boleh nak remove laptop apa semua, memang tak boleh, kiranya kalau remove hazard is tak boleh, elimination. Okay, we next go through the substitution, which is replace the hazard. Also engineering control, isolate people from the hazard. Administrative control, change the way people work, ataupun paling least effective is using PPE lah. Okay. Some yang kita most effective dekat sini adalah administrative control lah. Okay. Kita ada work shift, kita ada kita boleh buat exercise ke apa. Okay, itu adalah administrative control lah. Okay, so this is example for elimination. Okay, which is instead of lifting and transferring the object or raw material to another workstation, the least ergonomic from manual handling can be totally eliminated by performing the work process immediately. Okay, so maksudnya kita guna, maksudnya kita kena remove lah, kita kena remove lifting and transferring object ni, which is tak boleh. Okay, substitution, example, change the wooden crate to a lighter yet stronger material. Okay, sebagai contoh, wooden crate tu kita tukar kepada plastic crate yang lagi ringan lah, so dia tak terlalu berat. Okay. So next, for example of engineering control, workstation design, okay, ergonomically designed tools, ergonomically designed equipment, load weight reduction, okay, which is memerlukan budget lah for engineering control. Okay, and also this one example of proper practice, which is administrative control. Kita boleh buat cara proper lifting technique, team lift heavy or bulky awkward loads, stretching, work rotation, task variety, increase risk, break lah. Okay, ini adalah administrative control. Okay, and also PPE, kita pakai PPE lah. Okay, pakai PPE, which is the less effective lah. Okay, so kalau kita pakai PPE, mungkin kita akan reducekan kita punya sakit dekat tangan. Okay, itu adalah PPE lah. Okay, this one example lah, hazard, dia reaching above the head or shoulder. Okay, solution, kita boleh keep item within close reach ataupun elevate the work area lah. Okay. Okay, next we go through awkward body posture. Okay, apa solution? We can raise and or tilt the work for better access lah, and use a stool for ground level work. Instead, you kena bongkok ke bawah ambil barang. Okay, so kita boleh pakai this kind of tools lah. Okay, next repetitive motion. Okay, bila repetitive motion tu macam kita type dekat keyboard, buat typing. Okay, biasa dekat office work lah, kita klik and all that. Contoh CCTV operator ke, okay, finance ke, okay, finance office. Okay, apa solution? We can arrange work to avoid unnecessary motion. Let power tools and machinery do the work. Spread repetitive work out during the day. Take stretching pause. Rotate tasks with coworker if possible. Change hands or motion frequently lah. Okay. So this one, hazard, localize pressure on body parts. Solution, you can pad table edges or use table or desktop with on the edge. Use wrist rest, anti-fatigue mat, knee pads, shoe insert or other items that reduce stress on body parts lah. Okay. This one, lifting. Okay, so solution, you need to use proper lifting technique lah. Okay, ni cara-cara dia macam mana nak guna lifting technique. You kena jaga you punya body daripada belakang tu lah. So jangan membongkok, so cause dia akan buat lagi sakit, back pain lah. Okay, dia tak boleh membongkok lah, badan you kena straight. Okay, ini cara yang betul. Okay, so next we go to the next topic, office ergonomic. Okay, so this is the basic for office ergonomic. So for the monitor, you need to set the top of your monitor at or slightly below eye level. Okay, monitor tu kena you punya eye level, tak boleh naik ke atas sangat, tak boleh ke bawah sangat. Okay, then keep your neck straight instead of craning or twisting. Okay, keep your neck straight. Okay, then position your monitor about an arm's reach away. Okay, 20-20 rule. Look 20 feet away every 20 minutes for 20 seconds. Okay, look 20 feet away. Okay, so not adjustable. Please elevate with a stack of book lah. Okay, maksudnya kalau tak boleh adjust you punya monitor, please letak books supaya dia naik tinggi sikit lah. Okay, then tip laptop screen back to create more distance. Okay, position your screen away from light sources to limit glaring lah. Okay, maksudnya terlalu jangan light terlalu terang ke terlalu gelap ke, is macam suitable lah for your eyes. Okay, next, keyboard and mouse. Make sure your arm are close to your body with elbow near your side. Okay, you can refer here the perfect time lah. Okay, the perfect the correct of position of keyboard and mouse. Okay, which is kalau you use the keyboard at laptop is can is a proper way if you have external keyboard lah, external keyboard and mouse, and place them close to your body lah. Okay, dia akan buatkan tangan you rasa sakit lah kalau kita guna keyboard dekat laptop saja. Saya sudah baptis. Keep your wrist straight by floating your hands above your keyboard when typing, and learn common keyboard shortcut. Okay. Okay, next, chair. For your chair, choose a chair with back support and seat. Your back is fully supported. Recline slightly if possible lah. Okay, make sure ada support. Don't sit on a stool, couch or exercise ball. Add a chair pad and use a small pillow or towel to provide low back support. Okay, keep knees at 90 degrees. Okay, with a feet flat. No adjustable chair, please use footrest lah. Kan pastikan you punya feet cecah lantai. Okay, dia kena cecah lantai dan juga ada back support. Okay, you punya kiranya you kena duduk pun kena duduk dekat belakang-belakang. Kiranya make sure you punya badan straight. Okay, so and also for work surface. Okay, work surface boleh make sure dekat around you punya area tak terlalu sempit lah. Okay, remove clutter and any drawers directly in front of your seat. If your shoulder are not relaxed while working, try raising your seat or lowering your workstation. Okay, keep your knees at 90 degrees. Okay, with feet flat on the floor. Okay, so next, for environment, lighting should be bright over the head. Over, position your screen away from the other light sources to limit glare. Air quality is improved by increasing ventilation with a fan or by keeping doors open. Okay, so here the quick test to check your posture lah. Okay, you can do by yourself. First, stand with the back of your head against wall. Second, place heel 6 inch from the wall. Your buttocks and shoulder blades should touch the wall, and here there should be less than 2 inch between your neck or small of the back and the wall. A larger gap indicates bad posture and curving spine lah. Okay, maksudnya when you can test lah. Okay, so next we go through the transfer and lifting technique. Okay, kita pergi for teknik memindah dan mengangkat. Since kita so this one pun I get the slide from Pantai Integrated Rehab. They are teaching for this kind of techniques for nursing punya services lah. Okay, ataupun attendant also. Okay, so here the course outline. First, we can get the preliminary concept, general transfer principle, special precaution for stroke and hip fracture patient, important tips before transferring patient, transfer technique. Okay, there's transfer technique, standing transfer or minimal assist transfer, pivot transfer for one person assist, pivot transfer two person assist, back-to-back transfer, and also car transfer lah. So here transferring technique, and transfer is the process of patient moving from one surface to another. This process includes the sequence of events that occur both before and after the move lah. And many caregivers are unsure of the transfer type and techniques. Important to remember that each patient, caregiver, and situation are different lah. Okay. Okay. So must be aware of the following concept when selecting and carrying out transfer techniques to ensure safety for both the patient and staff. Okay. So you need to aware of the patient assets and limitation, especially the patient physical, cognitive, perceptual, and behavioral abilities and deficit. Know their own physical abilities and limitation, and whether he or she can communicate clear, sequential instruction to patient, and also aware of and use correct moving and lifting technique lah. Okay. Okay, so here general principle before transfer. Make sure you know the patient physical and mental capabilities. You have the helpers or not, transfer point, and inform the patient uh, before transfer the patient lah. Need to inform. And during transfer, you need to engage the patient, position yourself, and after transfer, sit patient safely and comfortably. Okay. So here the principle of transferring. First you can need to check the stability. Transfer surface should be same level. Try to use core muscles group and use proper body mechanic, and don't access patient abilities. Remove unnecessary bedding and obstructs lah. Okay. Next, patient explanation on instruction. Avoid causing injuries on patient skin or body. Avoid pull on patient hands or clothes. And transfer, always start with the hips. Okay, and always learn the basic transfer technique before proceed to advanced technique. Okay, I have video later I will show. Here the safety guideline. You have the helper or equipment. Okay, coordinate with the helper. Make sure clear space, secure grip, and also ergonomic. Okay, for ergonomic, this one you need to use leg muscle, not back. Okay, use your leg, bring weight closer to the body, embrace stomach muscle. Okay, and the important thing is to plan and inform lah. Alright. So this one the special precaution, langkah berjaga-jaga khas untuk stroke. Never pull on the affected arm, may result risk in shoulder subluxation. Jangan menarik lengan yang cedera. Okay. Ensure tube and attachment are properly placed prior to the procedure to prevent accidentally removal. Pastikan tube menyambung diletakkan dengan betul sebelum prosedur bagi mengelakkan ia terjabut secara tak sengaja lah. And place wheelchair at patient strong side. Ya, letakkan kursi roda di tempat kuat pesakit lah. For lower limb fracture, patah anggota badan bawah, check the weight bearing status before performing the transfer. Okay. And before transfer or lifting, evaluate if the patient can assist with the transfer lah. And prepare the patient for transfer by giving instruction instead. Staff should stand next to the patient all the time during transfer. Okay. For transfer technique videos, okay, we have the video for standing transfer, maneuver transfer. Okay, this one, the video you can refer and help you how to transfer correctly lah. Okay. There is pivot transfer for one person and for two person and to back transfer and also car transfer. Right here for the first video for transfer, standing transfer, minimal assist transfer. Sekejapnya. And here the voice on mana? How to can hear the sound or not?
No sound, Lera.
Okay, Cik Kama. Sekejap ya.
Position the wheelchair at
Yeah. Man, kemana yang Pak jadi kereta tu? Ha.
Leaving him or her. Last but not least, remember the tips for safe transfer. Communicate with patient and helper throughout the process. Position your chair close to the bed. Hold the patient close to your body, keep your back straight during the transfer. Assist the patient, don't lift. Ask for help, or use the transfer equipments if needed. Thank you for watching this video.
Ada meeting for yang ergonomics tu it's
Oh, saya tengok Pak.
ada cancel.
Jadi,
Okay.
Position the wheelchair at patient's stronger side with 30° away from bed. Lock the wheelchair, and keep it locked while the person is moving into or out of it. Remove the footrests and nearest armrest.
di bagian ini saya
Okay.
karena sudah minta misi.
Okay. Kayak gini.
Assist the patient to shift out from the chair. Ensure both feet are on the floor. Assist the patient to lean forward. Assist the patient by holding on to patient's upper back through the armpits. Stabilize patient's weaker knees by blocking the knees with your knees. Assist patient to pivot toward the bed. Adjust the patient's posture to ensure safety and comfort before leaving him or her. Last but not least, remember the tips for safe transfer. Communicate with patient and helper throughout the process. Position your chair close to the bed. Hold the patient close to your body, keep your back straight during the transfer. Assist the patient, don't lift. Ask for help, or use the transfer equipments if needed.
It's a seafood.
Safety is the key element in patient transfer. Two-person assistance can be used for patients who are unable to follow commands consistently, mild cognitive impairment, poor trunk control, or having moderate limbs weakness. This technique is best done in wheelchair with removable armrests and footrests to ensure both parties' safety. For bed rolling, stand at the patient's weaker side, assist the patient to bend the opposite knee. Put one hand over the pelvis and one hand under the patient's shoulder blade. Assisted patient to turn towards you. Remember to ask patient participate in the activity. Brings the patient's legs off to the floor, and stabilize patient's pelvis using another hand. Slowly assist patient to push up from lying to sitting. Remember to keep your back straight. After sitting up, guide the patient to move hip forward alternatively. Helper must always sit or stand close to patient throughout the transfer. Make sure patient's feet are flat on the floor. In preparing for transfer, remove patient's nearest armrest and both footrests. If armrest and footrests are not removable, push the footrests to the side or lift the footplate up. Position the wheelchair at patient's stronger side with 30° away from bed. Lock the wheelchair, and keep it locked while the person is moving into or out of it. Ensure patient's both feet always flat on the floor. The primary helper stand in front of patient, while another helper stand at closer proximity of chair. Assist the patient to shift out hip alternatively, and the primary helper stabilizes patient's knees by blocking the knees. The primary helper assists the patient to lean forward. Both helpers can support on patient's buttock or pants. In the count of 1, 2, 3, both of them lift the patient's hip at the same time and assist patient to pivot turn. Alternatively, helper can help to apply a gait belt around patient's waist, then both of the helpers can grip on the gait belt to assist patient in pivot turning. After patient had sit on the wheelchair, helper's knees had to block on patient's knees to prevent patient slide out from wheelchair, assist patient to lean body forward and shift patient's hip alternatively into the chair. Ensure patient's trunk posture is upright and comfortable in sitting. Once transfer complete, reattach wheelchair's armrest and both footrests, and then put on patient's both feet comfortably on foot plates. Last but not least, remember the tips for safe transfer. If more than one person is assisting, make sure to communicate. Always let your patient assist as much as possible. Do not let the patient wrap arms around your neck or back, as this can injure your back or neck. Do not pull the patient's arms. Protect your back, bend your knees during the transfer and maintain a natural curve in your back. Ask for help, or use the transfer equipment if needed. Thank you for watching this video.
Maybe that's recorded.
2 to 4 person can help in this bed to stretcher transfer. Explain the procedure to patient before transferring him or her. Ensure the two surfaces are at the same height. Position the stretcher parallel to and touching one edge of the bed. Lock and check all the brakes before transfer. Turn the patient into side-lying position. Insert draw sheet or sliding board under the patient's body and adjust accordingly. Sliding board is placed over the gap between the bed and stretcher. Each helper should assume a broad base of support with one foot in front of the other, with knees and hips flexed, keeping their body aligned and back straight. On the count of 3, the helpers on the stretcher side of the bed should gently pull the draw sheet toward themselves. Roll the patient to stretcher side, then remove the sliding board. Center patient on the stretcher with her body in alignment. Make sure patient is comfortable and raise the rails on the stretcher. Thank you for watching this video. Before performing the process of car transfer, driver shall think about where to park his or her car. Car shall not park on high pavements, drain covers or uneven ground. Car shall be parked on the level ground but not on a slope. Move the car to a location that will allow easy access and have space for the transfer process. Move the car seat back as far as possible before patient transferring in. Open the car door wide, and position the wheelchair at 30 degrees to the car. The foot pedals should always be swing out of the way or raised completely. Lock the wheelchair brakes for safety. The helper should stand inside the open door where the door meets the car. Help the patient move to the edge of the chair and lean forward. This shifts his or her weight over feet and will make it easier to pivot, stand and transfer. Stand in front of the person and bend your knees. To protect your back, keep your knees bent and maintain a natural curve in your back during the transfer. Help the patient turn and assist in lifting their legs into the car. Assist the patient to sit comfortably and apply the seat belt. To keep the wheelchair, remove or put away the foot plates. Unlock the wheelchair brakes, then fold the chair by pulling the middle of the seat upwards. Wheel the chair to the car boot. Bend your knees, keeping your back straight but not rigid. Take a firm hold of the wheelchair rims, tilt the wheelchair towards you slightly and lift in one smooth movement. Adjust the wheelchair to fit into the boot space. Before transferring patient out from the car seat, helper can wind down the car window. Position the wheelchair at 30-degree angle of the car door and lock the brakes. Help the patient to turn the hip out and at the same time lift the legs out onto the ground. Help the patient move to the edge of the chair and lean forward. This shifts his or her weight over feet and will make it easier to pivot, stand and transfer. To protect your back, keep your knees bent and maintain a natural curve in your back during the transfer. Help the patient slowly turn and sit to the wheelchair. Assist the patient to shift hip backward alternately and ensure the sitting posture is upright. When they're comfortably seated, place the footrests back in the original position. Unlock the brakes. Here are a few useful tips for performing safe car transfer. Slide the seat as far back as possible to allow for more legroom for the person trying to get into the car. Be careful when helping someone into the car. Do not pull the patient's arms. Don't let them pull on your neck. Be aware of how you are holding your body so that you do not accidentally injure your back. Sedan cars are recommended to be used in car transfer, as the car seat is almost the same height as the wheelchair. Thank you for watching this video.
That's all for ergonomic. Okay, obviously for the okay, we can proceed to the Q&A. Tak boleh ni. Okay. I will proceed to the Q&A session. Okay, everyone already submitted. Congrats, you have passed the. Anyone, semua orang yang dah jawab, okay, thank you. You can leave the this training. Thank you. Ada siapa lagi tak boleh access? Okay, thank you everyone.